general concept and new perspectives on blood circulation. For decades, it has been widely taught that the heart serves as the primary pump of the circulatory system, responsible for propelling blood throughout the body. According to this traditional view, the heart functions as a mechanical pump, generating sufficient pressure to push blood through various blood vessels, delivering oxygen and nutrients to every cell. However, recent years have introduced a groundbreaking perspective that questions, is the heart truly the main pump, or is it merely a component of a more complex mechanism? Dr. Stephen Hussey, in his book Understanding the Heart, suggests that the heart's role extends beyond merely pushing blood. He proposes that the heart creates a vortex in the bloodstream, a natural phenomenon akin to how trees draw water from roots to leaves without a heart. This theory posits that as blood moves through the heart, it is spun into a vortex, generating kinetic energy that facilitates efficient circulation throughout the body. Additionally, structured water, a form of water with a specific molecular arrangement, plays a crucial role in supporting blood flow. This type of water possesses enhanced electrical conductivity, boosts metabolic activity, and aids in oxygen transport, thereby enhancing circulatory efficiency beyond the heart's mechanical pressure. This new perspective opens avenues for improving cardiovascular and circulatory health by emphasizing the significance of the body's natural biological environment, water structure, and light energy, rather than focusing solely on the heart's mechanical function. Methods to improve blood circulation in the legs, ankles, and feet. Poor blood circulation in the lower extremities, including the legs, ankles, and feet, is a common condition, especially among older adults or individuals with sedentary lifestyles. This issue not only causes heaviness and swelling, but also increases the risk of varicose veins, numbness, and other cardiovascular problems. One emerging approach to enhance blood flow involves using infrared light to restructure water in the blood and stimulate natural circulatory processes. 1. The role of infrared. Light in blood circulation. Recent studies indicate that infrared light can help generate structured water within the body. This form of water, characterized by a stable molecular arrangement, enhances the transport of oxygen, nutrients, and waste products in the bloodstream. When blood contains more structured water, its circulation improves significantly, particularly in areas distant from the heart, such as the feet and ankles. Interestingly, over 50% of sunlight comprises infrared rays. Therefore, regular sun exposure during early mornings or late afternoons not only benefits bones and joints, but also naturally stimulates blood circulation. Additional methods to incorporate infrared light include using infrared saunas. This popular therapy increases body temperature, promotes vasodilation, and enhances blood flow. Sitting by a fireplace or campfire. These natural heat sources emit infrared rays, supporting blood circulation, especially beneficial during colder seasons. 2. Dual benefits of infrared light. Beyond improving the structure of water in the blood, infrared light offers several physiological advantages. Increased nitric oxide production. This molecule is vital for vasodilation, lowering blood pressure, and enhancing blood flow to the limbs. Improved circulation can alleviate swelling, cold feet, and leg pain. Support for vitamin D synthesis via UV rays. While infrared light doesn't directly produce vitamin D, sunlight, which includes UVB rays, stimulates vitamin D production in the skin, contributing to blood pressure regulation and overall circulatory health. Utilizing natural or artificial sources of infrared light is a safe, effective, and non-invasive method to improve blood circulation in the legs and feet. Practices such as proper sunbathing, using saunas, or simply sitting by a fireplace not only provide comfort, but also facilitate more efficient circulatory function daily. Reducing leg swelling, edema. Leg swelling, particularly around the ankles, feet, and calves, is a prevalent symptom of poor blood circulation or disruptions in the body's fluid exchange processes. Medically termed peripheral edema, this condition often results in heaviness, pain, and reduced mobility, especially among the elderly or those who remain seated or standing for extended periods. Addressing this issue involves not only appropriate physical activity, but also crucial dietary considerations. Key factors to naturally and effectively reduce leg swelling include 1. Potassium. a natural diuretic to reduce fluid retention. Potassium is an essential mineral that plays a significant role in fluid balance, heart function, nerve signaling, and muscle contractions. One of its primary benefits concerning circulation is its ability to eliminate excess water from tissues, thereby reducing water retention and swelling. Potassium acts as a natural diuretic, aiding the kidneys in filtering out sodium and water from the bloodstream, which decreases pressure on blood vessels and alleviates swelling in the lower limbs. Recommended intake. To help reduce leg swelling, consider consuming approximately 1,000–2,000 millinoliters of potassium daily through diet or supplements. However, individuals with kidney issues or those on diuretic medications should consult a healthcare provider before increasing potassium intake. Potassium-rich foods as bananas, sweet potatoes, avocados, spinach, pumpkin, watermelon, coconut water, black and white beans. Incorporating these foods into your daily diet can safely and sustainably improve fluid balance and reduce edema. 2. Limiting refined carbohydrates and sugars. A natural approach to reducing water retention. A commonly overlooked cause of water retention is a diet high in refined carbohydrates and sugars. Consuming large amounts of foods like white bread, pasta, cookies, and candies leads the body to store them as glycogen in the liver and muscles. Each gram of glycogen stored is accompanied by approximately 3 to 4 grams of water, resulting in increased water retention. Moreover, high sugar intake elevates insulin levels, disrupting the body's saltwater balance and triggering mild systemic inflammation, which can exacerbate leg swelling. Benefits of reducing sugar and refined carbohydrates. Decreased water retention in tissues, improved insulin sensitivity, reduced inflammation and lower risk of hypertension. Enhanced relaxation of blood vessels, supporting better circulation. Foods to avoid or limit. White bread and rice, pastries, cookies, and baked goods, sugary beverages, fast food and processed snacks, commercial breakfast cereals. Transitioning to a diet low in refined carbohydrates and rich in vegetables, proteins, and healthy fats not only helps reduce swelling, but also enhances cardiovascular health and weight management. 3. Sugar-induced vitamin B1 depletion. The importance of benfotiamine supplementation. An often overlooked effect of high sugar consumption is the depletion of vitamin B1, thiamine, in the body. Vitamin B1 is crucial for carbohydrate metabolism and maintaining the health of the nervous and circulatory systems. Deficiency in B1 can lead to symptoms such as burning sensations in the soles of the feet, numbness or tingling in the toes, fatigue and memory issues, peripheral circulation disorders. In severe cases, thiamine deficiency can cause beriberi, a condition affecting both the nervous and cardiovascular systems. Therefore, individuals with high sugar intake or long-term high carbohydrate diets should consider supplementing with benfotiamine, a fat-soluble form of vitamin B1 that offers better absorption and is particularly effective in treating peripheral nerve, reducing leg cramps, especially in the calves or feet, are a common phenomenon, often occurring at night or after physical activity. The sudden sharp pain and muscle tightness can cause people to wake up abruptly or stop all activity immediately. Many people mistakenly believe cramps are due to poor blood circulation, but the most common and fundamental cause is a lack of minerals, especially magnesium. 1. Understanding the true cause of leg cramps. While poor circulation can also be associated with muscle pain, in most cases, leg cramps are a typical sign of magnesium deficiency, an essential mineral that plays a crucial role in muscle and nerve function. Magnesium helps maintain electrolyte balance and regulates the activity of calcium and potassium in cells, which supports normal muscle contraction and relaxation. When magnesium levels in the body are low, muscles become overly excitable, leading to spasms, which we know as cramps. 2. Why is magnesium so important? Muscle function regulation. Magnesium naturally counteracts calcium. While calcium stimulates muscle contraction, magnesium helps relax muscles. Without enough magnesium, muscles remain overly stimulated, resulting in cramps. Cellular energy production. Magnesium is involved in ATP production, the primary energy source for cells. Without enough energy, muscles become weak and prone to spasms. Nervous system stability. Magnesium calms the nervous system and reduces overexcitation that leads to muscle spasms. Supports blood pressure and cardiovascular health. Magnesium deficiency doesn't just cause cramps. It can also lead to high blood pressure and irregular heartbeat. Hypertension. 3. Magnesium deficiency is hard to detect, but very common. Remarkably, 99% of the body's magnesium is stored in cells and bones, with only 1% present in the blood. Therefore, standard blood tests often fail to reflect a true deficiency. This means many people are magnesium deficient without even knowing it. Some signs that you might be lacking magnesium include leg cramps, especially at night, mild muscle twitching or eyelid spasms, insomnia or poor quality sleep, anxiety, irritability, chronic fatigue, high blood pressure, rapid heartbeat, increased sensitivity to noise or light. Chapter 4. How to effectively supplement magnesium to reduce cramps. Proper magnesium supplementation can significantly improve cramps within a few days to weeks. However, the type of magnesium and the dosage are key to ensuring effectiveness without side effects. Recommended dosage, recovery phase, 800 mg per day, preferably at night before bed. The body absorbs magnesium better at this time, and it also helps with sleep. Maintenance phase. After symptoms improve, reduce to 400 mg per day to maintain stable magnesium levels. Note, individuals absorb magnesium differently. If you experience diarrhea, adjust the dosage or switch to a more easily tolerated form. Recommended form, magnesium glycinate. There are many forms of magnesium available: oxide, citrate, chloride, sulfate, taurate, glycinate. Among these, magnesium glycinate is the most recommended because it absorbs well through the digestive tract. It causes fewer side effects, e.g., diarrhea, bloating. It has a calming effect on the nervous system, promoting better sleep and muscle relaxation. It's suitable for people with sensitive stomachs. Avoid magnesium oxide. It's poorly absorbed and more likely to cause diarrhea. 5. Magnesium-rich foods to include in your daily diet. In addition to supplements, you can boost magnesium levels naturally through your diet. Dark leafy greens, spinach, kale, Swiss chard, nuts and seeds, almonds, pumpkin seeds, sunflower seeds, legumes, black beans, soybeans, red beans, whole grains, oats, brown rice, dark chocolate with 70% cocoa content, avocados, salmon mackerel. However, in many cases, food sources alone may not be sufficient to correct a deficiency, especially when magnesium loss is increased due to stress, heavy physical activity, sweating, or a diet high in sugar, caffeine, or alcohol. Understanding the root cause of cramps helps you find an effective solution that addresses more than just symptoms. It supports overall health. Leg cramps are often not due to poor circulation, but a sign of magnesium deficiency, a mineral essential for muscle function. Supplementing the right type and dosage of magnesium glycinate is a safe and effective way to reduce muscle spasms, improve sleep, and stabilize the nervous system. Maintaining a magnesium-rich diet while reducing sugar, caffeine, and alcohol will help ensure lasting results. If you frequently experience leg cramps, especially at night, try supplementing magnesium as guided above. You may notice a remarkable difference in just a few days. Common mistakes when trying to improve blood circulation. When taking care of circulatory health, especially in the legs and lower extremities, many people unknowingly apply methods that do more harm than good. Below are 2 common mistakes to avoid if you are dealing with leg swelling, varicose veins, leg pain, or cold, numb feet. 1. Misusing compression stockings. Compression stockings are often marketed to improve leg circulation, help veins return blood to the heart, prevent varicose veins, and reduce fatigue after prolonged standing or sitting. However, incorrect use, or using them in the wrong context and may be harmful. When can compression stockings be harmful? People with arterial insufficiency or vascular constriction issues. If the blood vessels are already narrowed or blocked, wearing compression stockings can further restrict blood flow, leading to cold toes, discoloration, or even leg ulcers. Wearing overly tight stockings or wearing them continuously all day without removal, this may increase pressure on capillaries, obstructing reverse blood flow, causing pain, worsening swelling, or aggravating varicose veins. Choosing the wrong type or compression level. There are various types of stockings with different compression strengths. Using the wrong one, especially without medical guidance, can backfire. Who should use compression stockings and how? People with mild varicose veins, who stand for long periods, or who are post-surgery, may be advised to wear mild compression stockings, 15-20 millimeters. Always check ankle brachial index, ABI, and arterial flow before use. Do not wear compression stockings 24/7. Remove them during sleep to avoid disrupting nighttime blood flow. If you experience cold toes, leg pain, or increased swelling while wearing them, stop use immediately and consult a vascular specialist. 2. Doing high-intensity exercise, HIIT, with poor circulation, leg swelling, or varicose veins exercise is great for circulation, but not all forms are suitable for every condition. People with leg swelling, varicose veins, or circulatory disorders in the lower body should avoid high-intensity interval training, HIIT. Why can HIIT be harmful in some cases? HIIT requires rapid increases in heart rate and blood pressure. When veins in the legs are compromised, they can't return blood to the heart efficiently, causing blood pooling in the legs, worsening swelling, tension, and varicose vein symptoms. Additionally, intense exercise increases oxygen demand, which may exceed supply in people with poor circulation, leading to fatigue, cramps, or temporary localized ischemia. Symptoms that worsen after inappropriate exercise: increased leg swelling post-workout, burning or deep pain in the calves, more prominent varicose veins, general fatigue, insomnia. 3. A safer alternative, gentle, consistent movement. Instead of HIIT or heavy resistance exercises, e.g. heavy squats, jumping, people with poor circulation should opt for low-impact activities that promote natural muscle-assisted blood flow. Recommended gentle exercises: slow walking for 15-30 minutes daily activates leg muscles and helps pump blood back to the heart. Leg elevation with ankle pumps. Lie on your back, elevate your legs on a pillow or wall, and gently flex to extend your ankles to help fluid return. Heel-to-toe rocking. Stand with support, slowly lift your heels, then your toes. This activates the calf muscles, acting like a natural vein pump. Gentle yoga or leg stretching. Poses like legs up the wall are especially beneficial for lower body circulation. 4. Conclusion. Be careful with circulation-boosting methods. Improving blood circulation isn't just about moving more or using more tools. Each method must suit your specific vascular and circulatory condition. 2 common mistakes: misusing compression stockings and doing inappropriate high-intensity workouts can worsen your symptoms and increase the risk of complications. Always listen to your body. If you feel more pain, swelling, or discomfort after trying something, pause and reevaluate. Start with light activity and increase intensity only if your body responds well. Consult a vascular specialist before using compression wear or starting a new workout regimen, especially if you have a history of vascular disease, high blood pressure, or diabetes. Simple and effective exercises to improve leg circulation. Poor blood circulation in the legs is one of the most common causes of discomfort, including swelling, pain, heavy legs, numbness, and cold feet. If this condition persists, it can lead to serious issues such as varicose veins, leg ulcers, or even blood clots. One of the most effective, easy, and safe ways to improve blood flow to the lower limbs is through gentle exercises that target the ankles, calves, and feet, areas that act as natural pumps to help return blood from the legs to the heart. Below are 3 simple exercises that anyone can do at home, even if you have limited time or cannot go outside to exercise. Shock 1. Leg elevation against the wall with ankle movements. This is a highly effective exercise that helps reduce foot and ankle swelling and promotes venous blood return to the heart using both gravity and gentle ankle movement. How to perform: lie on your back on the floor, bed, or a yoga mat. Raise your legs up against the wall at a 90-degree angle to your torso. While holding this position, begin moving your ankles by flexing your feet up and down, like pressing and releasing a bicycle pedal. Do this for 1 to 2 minutes per session, 2 to 3 times a day, especially in the evening after prolonged standing or sitting. Benefits: reduces blood and fluid stagnation in the lower limbs. Slightly lowers blood pressure by reducing pressure in the legs. Relieves heaviness, tingling, or dull pain in the feet after a long day. Tips: older adults can place a pillow under their lower back for added support. Combine with deep breathing and closed eyes for relaxation. 2. Seated ankle pumps at your desk. This super convenient exercise is perfect for people who sit a lot. Office workers, drivers, students, or anyone spending long hours at a desk. Whether you're at work, on a plane, or at home, you can do this anytime. How to perform: sit upright in a chair with your feet flat on the floor. Begin flexing your ankles up and down, as if you're pressing and releasing a car pedal. You can move both feet at once or alternate them. Repeat 20-30 pumps each session, at least 3-4 times a day if you sit for long hours. Benefits: activates calf muscles, the muscle pump that pushes blood back to the heart. Prevents blood clots from prolonged sitting. Reduces leg numbness or pain after long periods of immobility. Pro tip: set a phone reminder every 1 to 2 hours. Stand up and walk for a few minutes every hour to boost circulation. 3. Heel to toe rocking. This mimics the natural pumping action of calf muscles. When you rock from heels to toes, your calf muscles rhythmically contract and relax, helping push blood upward and reducing pooling, especially helpful for people with varicose veins or chronic leg swelling. How to perform: stand straight, lightly holding onto a wall, chair back, or tabletop for balance. Rise onto your toes, then lower your heels and lift your toes, shifting your weight between heels and toes. We repeat this rocking motion 10 times per set, several sets per day. 3 to 5 sets is ideal. Once you're stable, try doing the exercise without support. Benefits: stimulates calf muscles, which play a key role in venous return. Increases blood circulation and reduces swelling. Supports mild varicose vein relief and improves ankle mobility. Modifications: beginners or elderly individuals can go slow and hold on to something. More active people can increase the pace or duration. Can not do it anytime, after waking up, before bed, or after sitting too long. Simple exercises. Surprising benefits. Though these exercises are simple and require no equipment, they serve as light physiotherapy methods that are safe and highly effective in improving lower limb circulation. They help reduce swelling, cramping, and leg fatigue while preventing dangerous vascular complications. Be consistent. Don't just exercise when symptoms appear. Stay hydrated, eat plenty of vegetables, and reduce carbs to support better circulation. If you have chronic vascular conditions, consult your doctor before starting new exercises. Start today, even with just 5 minutes per session. You'll feel a noticeable difference in your legs. What? Contra cold feet. Causes and natural improvement with iodine. Cold feet are a common complaint, especially among older adults, sedentary workers, women, and those with hormonal imbalances. While it may seem minor, frequent, or persistent cold feet, especially when accompanied by fatigue, tingling, or pale skin, could be a warning sign of underlying issues like thyroid dysfunction, particularly hypothyroidism. Why does hypothyroidism cause cold feet? The thyroid is a crucial endocrine gland in the neck that produces T3 and T4 hormones, which regulate many bodily processes, especially metabolism. affecting body temperature, circulation, and nerve function. When the thyroid is underactive, hypothyroidism, hormone levels drop, leading to slower metabolism, reducing heat production, making extremities like feet feel cold, reduced peripheral circulation, limiting blood flow to the limbs, mild fluid retention, causing numbness and discomfort in the feet. In early stages, hypothyroidism can be subtle, and cold feet may be one of the first warning signs. Iodine, essential for thyroid function. The thyroid needs iodine, a trace mineral, to produce T3 and T4 hormones. Long-term iodine deficiency can weaken the thyroid, eventually leading to clinical or subclinical hypothyroidism. While severe iodine deficiency is now rare, thanks to iodized salt, mild insufficiency can still occur, especially in people who rarely eat seafood or seaweed, follow vegetarian or restrictive diets, live in mountainous regions where soil and water lack iodine, consume too many foods that inhibit iodine absorption, e.g. raw soy, cabbage, turnips, sea kelp, a natural absorbable iodine source. Sea kelp, dried seaweed, is among the richest natural sources of iodine. It's commonly used in Japanese and Korean cuisine, e.g. seaweed soup, salad, and is also available in supplement form. Benefits of proper sea kelp supplementation: supports stable thyroid function, improving basal metabolism and body heat production. Enhances peripheral blood flow by balancing hormones and blood pressure. Alleviates cold hands and feet, fatigue, dry skin, classic signs of mild hypothyroidism. How to use sea kelp and important notes. Recommended iodine intake. WHO recommends 150 mg a day for adults. Pregnant lactating women need 220-290 mcg a day. Some sea kelp tablets provide 100 to 200 mg tablet. Do not exceed unless directed by a doctor. How to use. Take 1 tablet daily in the morning after meals. If using dried seaweed, cook it to reduce anti-nutrients and soften the fibers. Important precautions. Do not self-medicate with high doses if you have known thyroid conditions, goiter, hyperthyroidism. Consult your doctor before adding high-dose sea kelp if you're on thyroid hormone therapy. Avoid raw goitrogenic foods, e.g. broccoli, kale, soy, turnips, when taking iodine. Cooking neutralizes these effects. What's beyond iodine? Other ways to improve cold feet. In addition to iodine from sea kelp, consider these supportive habits. Keep your feet warm with wool socks or warm packs at night. Practice light foot and ankle exercises to boost circulation. Supplement with magnesium, vitamin B1, and potassium if you have swelling or cramps. Avoid caffeine and smoking. Both restrict peripheral blood flow. Get 15-30 minutes of gentle morning sun exposure to support circulation and vitamin D synthesis. A natural, simple solution for cold feet. Cold feet are not just about temperature. They could be a sign your thyroid is underperforming. Supplementing with iodine, especially from natural sources like sea kelp, is a safe and effective way to support thyroid health and reduce symptoms. However, for lasting benefits, you should combine it with healthy eating, light daily movement, and regular checkups if symptoms persist. Listen to your feet. They're not only taking you everywhere, but also reflecting your circulation and hormonal health. Natural and effective solutions to improve circulation. Infrared light exposure. Infrared rays from sunlight, heaters, or saunas help boost blood circulation and support the formation of structured water in the blood, a form of water that enhances nutrient and oxygen transport throughout the body. 2. Proper nutrition. Potassium naturally reduces swelling and acts as a gentle diuretic. Magnesium helps prevent muscle cramps and supports healthy blood pressure. Iodine supports thyroid function, which in turn improves cold extremities. Vitamin B1, benfotiamine, alleviates foot pain caused by nerve damage due to deficiency. 3. Eliminate refined sugars and carbs. Foods like white bread, pasta, and pastries can lead to water retention, micronutrient deficiencies, and metabolic imbalances, factors that worsen symptoms in the legs such as swelling and poor circulation. 4. Gentle exercise, activities like walking, leg elevation, and ankle pumping help move blood and fluid back toward the heart, significantly improving swelling, cold feet, and leg fatigue. Listening to your body and applying these simple, natural measures can bring noticeable improvements to your leg health and overall circulation.